من الترانزيشن بتاع الانفكشن ده، وافترضوا ان كل الناس المترددين على المستشفى بوزيتيف لغايه ما يثبت العكس، مش ان هم نيجاتيف لغايه ما يثبت العكس. والتباعد اللي بنقعد نقول عليه الفيزيكال والجوانتيات والبعد عن كل الوش والحاجات دي كلها مهمه قوي يا جماعه. اهم حاجه بالنسبه لكم دلوقتي سلامتكم اولا زي ما نقول. مش عاوزين نعمل من واحد عنده فيروس لاثنين ولا ثلاثه بعد الشر. فنتكلم النهارده على الدريسنجز. امبارح المره اللي فاتت اتكلمنا على ايه يا ربي، على الفلويدز. النهارده نتكلم على الدريسنجز. و يعني طبعا كان بيبقى عندنا سامبلز نوريها، عمرو جابهم كل الحاجات اللي افيلبل دلوقتي، فنبص عليهم. و يعني طبعا من السكيلز المطلوبه الواحد يعملها انه يعرف يدرس ووند. ويبقى السؤال هو الاولاني: why do we dress wounds؟ why and who dresses wounds؟ يلا مين هيقول لي؟ عمرو، هل حد عاوز يقول لي مين why do we dress wounds؟
احنا معانا ماجد يعني.
ماجد، هو ماجد دلوقتي احنا الثلاثه مع بعض بس ولا حد معانا تاني؟
لا
احنا الثلاثه.
احنا 12 يا دكتور.
طب هايل، ماجد هو اللي عاوز يقول ولا حد تاني عاوز يقول؟ ماجد يلا. why do we dress wounds؟
او حضرتك حابب تفتح الفيديو ولا لا؟
افتح الفيديو طبعا. ما فتحتوش ليه؟ طيب لا مش قاصد خالص.
لا ولا يهمك يا دكتور. تمام.
يلا يا ماجد، ليه why do we dress wounds؟
To prevent infection. The surgical site
infection. We dress wounds to prevent infection. Okay. Can you leave a wound open? Can you leave a wound open? Can you leave it without a dressing? What is the answer? Can you leave it without open ولا can you not?
You should cover it. يعني ممكن يبقى في استثناءات للقاعدة دي.
You should cover it. طبعا هيبقى في exceptions، بس هو الحقيقة انكم عارفين ان في occlusive method و open method to dress wounds. بس طبعا عشان الواحد يليف an open wound open لازم يكون in a special environment. لكن after a few days, 5 or 6 days, you can leave the wound exposed. You can leave it without a dressing. But if you dress a wound for the first time in order to prevent infection, which may be very true, but why do you keep dressing it over the coming few days? Why do you dress it after that?
The wounds محتاجة moist environment عشان to promote healing.
يعني ماجد بيقول دلوقتي you want to promote you want to optimize the environment so that the wounds heal. Okay. بس في حاجة مهمة قوي. why would you like to look
لو في bleeding او لو في اي exudation نشوف ايه لونه او كده.
ايه
لو في اي exudation او اي bleeding.
بالظبط كده. يعني قصدي there's one very important aim behind you dressing a wound. Surgeons in Arabic, obviously the name جراح derives from wounding people. ولو ان احنا دايما نركز على if you wound someone you have to know how to heal them, otherwise you'd be not a surgeon, you'd be someone else. You need to assess the wounds yourself. In a lot of countries, nurses will basically dress the wounds, but surgeons will have to at least inspect the wound because they may derive very important information from inspecting wounds. Obviously انتوا تقولهم لي حالا دلوقتي. وطبعا دلوقتي بما انه we're in the era of photography and we're photographing everything on earth, this is a very precious tool because it was very common practice that you, in order for different surgeons to inspect the same wound, the wound would be dressed so many times every day without any need just to inspect it. طبعا دلوقتي in the presence of very easy photographing wounds and sending them anywhere طبعا, which is not very up till now, which is not very legal, but طبعا it's always acceptable. اوكي. فيبقى اول سؤال هو ايه؟ why do we dress a wound؟ طبعا عندنا two types of wound. الوند الاولاني اللي هي التروماتيك wounds والنوع الثاني اللي هو السيرجيكال wounds. طبعا عندنا closed wounds open wounds، واحنا الاول هنبتدي نتكلم بس على ايه؟ على السيرجيكال closed wounds الاول. السؤال الثاني هو given that a wound is a post-operative wound and it's a closed wound. The classic example in the surgical ward, on the surgical ward, when someone is operated for whatever indication, be it a hernia, bypass, whatever indication it is. Well, the question is, and the wound obviously is sutured at the end of the procedure unless it is grossly contaminated or infected. Obviously, you will not suture a wound that is contaminated or infected. And at the end of the procedure, you close. If it's not infected nor contaminated, you close it. And then the question is, when would you dress a wound? يلا مين هيقول لي؟ هنتكلم على في surgical wounds, في traumatic wounds, and they end up either being closed or they remain open. وبنتكلم دلوقتي على ال closed wounds, clean closed wounds. زي ما بيقولوا كانوا يسموهم tidy wounds. طبعا surgical wounds are all tidy ones and they're clean and they're closed and everything. When would you dress that wound?
post operatively.
كنا بنقول السؤال حد هيرد عليه عمرو. when would you dress a wound? when you dress a closed surgical wound and a clean closed surgical wound.
لما نبقى خايفين ان يحصل مثلا هيماتوما مثلا فنعمل compression بالدريسنج.
اوكي طيب وايه كمان يعني دلوقتي someone has been operated, they've had whatever procedure, be it an open cholecystectomy which is rarely done, a hemicolectomy, كان laparoscopic طبعا because with laparoscopy you have very small wounds. I'm sure you all know that. But if you've got a more major procedure, even like a bypass or a thyroidectomy, أي حاجة من الحاجات دي, when would be, what are the indications to dress a wound? Would you dress it the next day? Would you dress the wound the next day?
لا المفروض في نفس الوقت بعد العملية على طول ولا ايه؟
Okay, بعد يعني خلاص people are coming out of theater with their wound dressed. When would the next time of dressing be?
المفروض بعدها يعني regularly كده بيبقى بعدها مثلا مرتين في اليوم، بعد كده بتقل مثلا، مش عارف بصراحة الوقت قد ايه.
يعني هو you wouldn't dress a wound as long as it remains clean until you're ready to take the sutures out. يعني القاعدة بتقول إنه wounds are not dressed as long as they're closed and as long as they remain clean. يبقى السؤال هو how would you suspect that wound is becoming infected? Because if you suspect it to become infected, then you need to look at the wound. يبقى إيه هي عمرو عاوز تقول؟
ممكن مثلا لو في فيفر مثلا يبقى كده في علامه ان في surgical site infection.
If you suspect that the wound has become infected, then you need to know what's going on with the wound. You do not dress wounds until you're ready for the sutures to be taken out. And you dress wounds when you're ready for the sutures, the staples. ودلوقتي هنتعرض يا عمرو حالا لحكايه الستaples والsutures and how do we remove them and what do we use to remove them and when do we remove them. بس الاول عمرو دي كده احنا كده ماشيين مش كده؟ انا شايف الفيديو والصوت موجودين الاثنين.
حضرتك موجودين.
اوكي فاحنا كنا بنتكلم على انه you don't dress a wound. Wounds come out of the theater closed and dressed. You do not redress them until you're ready for the sutures to be removed. When do you remove the sutures or the staples? I'm sure you all know that. ايه يا عمرو بتقول ايه؟
حسب المكان اللي هي فيه.
حسب المكان. طيب فين بقى؟ يلا يا عمرو قول انت او ماجد لو عايزين تقولوا يلا.
يعني الفيس من 4 ل 5 ايام.
في الفيس من 4 ل 5 ايام maybe less كمان يومين 3. ايوه في النك. في النك
اسبوع.
لا في النك هو كده برضه 4 5 ايام. طب وفي الترانك
10 ايام تقريبا.
7 ل 10 ايام بالظبط. وفي الاكستريميتيز
اسبوعين
12 ل 14 يوم بالظبط كده. يبقى دي rough estimates because obviously you'll be asked this question a lot. يبقى الواحد يبقى عارف بس هو يشيل غرز امتى. طبعا البني ادم ساعات بيبقى فيه غرز ما بتتشالش لانها بتبقى subcuticular وبتبقى absorbable فممكن ما تتشالش. وطبعا ممكن تبقى staples وهنتعرض للكلام ده حالا دلوقتي ازاي الواحد يشيل غرز وبايه بيشيل غرز والقصه دي كلها. ولكن at times الناس بيقولوا ان لما بيبقى فيه غرز او staples بتتشال دي بتعلن ان البني ادم كانه خف
الواحد بيبقى عاوز كده خط واضح يقول انا كنت لسه في نقاهه وبعد كده خلاص انا overcome this problem. طبعا ممكن يكون اعوذ بالله هاخد علاج بعد كده and so on، بس بيبقى عاوز يبقى draw a line between that he was being operated upon and now that he's okay. فيبقى الواحد هيشيل غرز زي ما انت قلت بالظبط كده في الوش يمكن اقل بكتير. كل ما بيشيل غرز بدري كل ما يبقى العلامات اللي باينه منها تبقى اقل. طبعا ممكن تكون سبكتيكولر، والسبكتيكولر بتبقى ابزوربل او نون ابزوربل، والابزوربل مش هتتشال. من الحاجات اللي الواحد بيكتبها في النوتس، العمليه مهمه قوي، لان البني ادم بيسال، ولو ما كانش هو الجراح يبقى عاوز يعرف الغرز دي هتتشال. ان العيان بيسال، بني ادم بيسال دايما هشيل غرزي امتى؟ ممكن يبقى الاجابه لا مش هتشيل غرز. مهم البني ادم يتقال له اجابات عشان ما يبقاش منتظر حاجه مختلفه، وعشان ما يفتكرش ان احنا يعني ايه we did not give him enough care. These things are very very important to document what sutures have used, and are they removable or not removable? I mean absorbable non-absorbable, and you have to tell people when to remove them. وانتوا عرفتوا كده او انتوا عارفين طبعا. الوش يومين 3، الرقبه 4 5، الترانك او التورسو يعني او 7 to 10 days of 12 to 14 the extremities. ولو ان احنا في اي condition في delayed wound healing، لما في delayed wound healing بقى المالجنسي والكيموثيرابي والكورتيكوستيرويدز والهايبوبروتينيميا والهايبوالبومينيميا والقصه دي. But the skin from this point of view it's important because it will still cover the underlying structures. ويبقى you can use subcuticular absorbable, you don't need to remove them. Subcuticular non-absorbable you remove. Ordinary skin stitches, interrupted skin stitches, absorbable you may leave behind. Although it will take a long time for them to be absorbed and people may still be keen on having them taken out, or you'll use non-absorbed that you need to take out. أو staples. عمرو بقى ممكن تورينا الصور الحاجات دي؟ هنشوف مع عمرو، هنقدر نشوف الصور؟
اتفضل يا دكتور، حضرتك حابب تشوف ايه؟
احنا كنا في الريل لايف سيشنز كنا بنقعد نستعمل ستيبلر وستيبل ريموفر، لكن ادينا هنشوف الستيبلر. طبعا ستيبلر مالهاش اي ميزه، الستيبلر اغلى شويه، لكن لا يمكن اوفرول مش اغلى، لكن طبعا سريعه قوي شكلها ما بيبقاش وحش خالص. هنشوف الستيبلر من فضلك. ادي الستيبلر والستيبل ريموفر اهم جنب بعض، بيبقى غالبا فيها 35 او طبعا variable number. You can see them in the ventral او the under surface of the stapler. وبعدين يا عمرو هتوريها بقى هم بيتحطوا من فضلك.
طيب حاضر.
بس معلش يا عمرو انا عارف ان انا بعمل لكم لخبطه جامده، معلش
خالص.
احنا لسه مع بعض يا عمرو ولا؟
مع حضرتك.
This is the stapler, and you see how it everts wounds beautifully coapted. You put the center of the depressed part overlying the wound, and you simply fire the stapler and you pull upwards and so forth. It's a very quick method. If you've got a long incision that you need to close, you will close it using sutures for over a few, maybe 10 minutes or so. But if you staple it, it will take no time. That staple, you have to remove it. If you take staples, you have to have a staple remover. You don't just use an RT forceps in order to remove the staples. Otherwise, it becomes very painful. People do not like staples. They do not like the appearance of a staple. They think it's very painful. Well, this is how you tend to remove them. You pass the blade of the stapler اهو طريقه ظريفه قوي, and it sort of levers the two edges of the staple upwards, and it comes out. It simply comes out. طبعا these instruments are all disposable. You have to they're one individual, and you just throw them away, and that's it. يبقى دول الستaples. Remember, the staples are a stapler I think costs no more than, I don't know, but it costs something like 50 pounds. I'm not so sure, maybe more. لكن the main advantage of a stapler is its speed. Okay, يبقى stapler و stapler remover. When you remove stitches, the staples طبعا نفس الكلام. They do not look worse than stitches at all. ويلا عمرو بقى هتورينا من فضلك how do you remove stitches? How about the stitches? If you're about to remove stitches, طبعا you do not use your hands, because some people eat using their hands. it's not a problem. But we usually, in particular these days, we don't usually eat using our hands. But people usually eat socially. They keep eating using a knife and the fork, and they're taught how to hold them and how to use them. ومش عارف what etiquette do they learn and so forth. لكن أهو هنا you are holding the suture. الصورة باينة قوي. And there is the scissors. وطبعا you have to use forceps that hasn't got any that is يعني not a kocher. It shouldn't have any sort of teeth at the end. You lift it up and you sort of cut it flush. شايفين? You cut it flush with the skin. You're cutting flush with the skin. You shouldn't be cutting it away from the skin, because if you cut it away from the skin, that part of the suture that lies outside will be driven inside the skin. The trick. It's not very important realistically, because I don't think it's very important realistically, but it's important to know, because you shouldn't be just a technician. You should be a sort of a doctor is not a technician. They are a technician, yes, but they're also scientists, which means that they know a bit of science behind what they do. They don't just know what to do. They know a bit of why do they do that and how do they do it and what is the concept behind it. يبقى اهو بالظبط الصورة الظريفة اللي هي بتقول إنه you have to cut flush with the skin so that no part of that suture that was outside the skin is thrown inside. Okay, you have to cut using the pair of scissors, and you have to be parallel to the skin, not perpendicular to the skin. If you're parallel and very close to the skin, flush with the skin, then you don't drive part of the suture that was outside inside. I hope that the diagrams are clear, and I hope that I'm clear enough. طبعا if we were real life it would have been much easier. عمرو احنا لسه مع بعض ولا في مشكلة؟
مع حضرتك يا دكتور.
طيب يا عمرو بعد كده هنشوف ايه يا ربي؟ هنشوف بقى عاوزين نشوف مع بعض the dressing forceps. There's a special dressing forceps in our hospital. Unfortunately, you are given anything to. أولا, this is the scissors that is very specific for removing sutures. This is obviously a forceps. It hasn't got any sort of teeth at the end. A kocher will have one teeth at the end. In this hospital, you may be given any sort of instrument. At times, people use their hands to dress wounds, and this is unfair. It is not fair. It is not fair to submit to the nursing staff that you're not given anything when the instruments are there. And if it ever happens that you're going to use your hand in order to dress, you have to wear a sterile pair of gloves. Sterile pair of gloves. If you hold everything with your hand directly, then you should be holding them with a sterile pair of gloves, not the gloves that you use in order to I don't know, to protect yourself and so on. They have to be sterile. وطبعا opening gloves is very, very important. When you open a pair of gloves or you open anything, you peel things, you don't cut things. الناس عندهم كده habit. The gloves that are available in this hospital are not all easily peelable. You peel, you do not cut, because if you cut, then you're disrupting their sterilization and so forth. And if you're ever opening something that's sterile, make sure that you're opening and something sterile is lying underneath you. Otherwise, it falls on the ground and it becomes lost. طبعا in a pair of gloves, it's not important, but at times this happens with a graft or with a very expensive prosthetic. دول الفورسبس اهم. لكن في بقى الدريسنج فورسبس يا عمرو اللي هو اولا شفتوا السيزرز. عمرو السيزرز مره ثانيه. The scissors, obviously you can use any pair of scissors. You can use any pair of scissors. عمرو انت لسه معايا مش كده؟ انت لسه معايا عمرو ولا خلاص؟
مع حضرتك. لا مع حضرتك.
طيب مش هنطول. قربنا. لا ما قربناش قوي يعني، بس قربنا برضو. عمرو فين السيزرز مره ثانيه؟
دي حلوه
اهو. very specific pair of scissors. You can see its tip. You can see its tip so that it slides underneath the suture. And you've also seen امر الدريسنج فورسبس ولا انت ما جبناش دريسنج فورسبس؟
جبنا ده. يا دكتور حسين.
طيب يبقى احنا شفنا الديفايسز والفورسبس والحاجات دي. هو في فورسبس تاني غير ده؟ يبقى في فورسبس like an artery forceps with pieces for your 2 circles for your fingers, but it hasn't got a lock. An artery forceps has got a lock, while an dressing forceps hasn't got, it lacks a lock. Okay, but I hope that you by now have known that you can use staples. You have seen how the stapler looks like. How does it operate? طبعا it will be better if you see it real life. You have seen how to remove the staples. You have seen how to remove the stitches. The stitches can be absorbable, non-absorbable. If they're non-absorbable, they have to be removed. And when? If they're absorbable, it depends upon what the individual wants. If you convince them that they don't have to have them removed and they're happy, it's okay. But if not, then you have to remove them. Or be a bit compliant. You can do things as long as they're not wrong. If people want something done, you can do them. You can do whatever they want. يعني خليكوا شويه compliant كده، مش لازم تبقوا very rigid. مش هيحصل حاجه لو شلنا غرز وهي absorbable as long as the individual, because they keep in the wound for a while before they fall. يبقى عرفنا الكلام ده. ويبقى رجعنا نقول تاني: when you dress a wound, you dress a wound only if you suspect. If you're going to remove the stitches, obviously, but if you're not going to remove the stitches, you redress it only if there's طبعا a raw area, then open wounds are dressed. Like closed wounds are only dressed if you suspect an infection. If the wound becomes, obviously, if it's painful, if it's tender, if the dressing is soaked, if there's a fever, and if there's a drain, you dress the drain, and if there are flaps that you need to inspect. في good indications for you. You shouldn't be dressing wounds on a daily basis. As long as they're clean and closed, you shouldn't be dressing them on a daily basis. In fact, this will expose them to. عمرو انا معاكم لسه ولا ايه؟
حضرتك يا دكتور.
معانا احنا مع بعض يا عمرو؟
مع بعض
Okay, فيبقى this should be very clear. You should dress wounds daily. If there's an infection or there's a question about the viability of the flaps, you've created the flap and you're not happy with the flap, like when you perform, for example, an amputation, when plastic surgeons cover raw areas using a flap and this sort of thing. It's clear cut that you don't need to dress the wound. Obviously, the next day, you don't dress wounds daily. واتفقنا ان it is of importance to dress the wound if there is عمرو انا معاكم. انا الشاشه بتاعتي بقى خلاص اوكي. لو في suspicion of infection, locally there's pain, locally there's tenderness, locally there is discharge, the dressing is soaked. If there's a drain, obviously you will dress the drain. Drains come out beside wounds, they don't come out through the wound. And then they are dressed daily, but the wound itself may not be dressed at all, and you just dress the drain. And you shouldn't be getting drains out of the main wound. You should get drains out of a separate stab, like I'm sure you all know. Okay? A flap, if there's a flap, then you need to assess the flaps with amputations. If someone has performed a colostomy, had a colostomy performed, then you need to assess the viability of the colostomy. الحاجات دي هي اللي بتبقى الواحد بيدرس فيها wound. ويبقى السؤال اللي بعد كده يعني اللي قلناه لغايه دلوقتي: why do we dress wounds? Remember that you dress wounds for a very good reason, and that is obviously to make sure that the wound is healing. You want to inspect the wound, and nurses may very well dress wounds, not in this country because very specialized, experienced nurses dress wounds all over the world, but surgeons need to keep an eye on the wound. And if they're not available during the dressing, then they have to have photographs sent in order for them to assess wounds. This is a very common scenario in trauma. In trauma nowadays, when people come to the casualty with their wounds, trauma wounds compressed and dressed and so forth, you'll not need to open them because you can very well have a photograph of the wound, and then you're ready to take decisions, and you're ready to operate if need be. Remember that this is not very legal, and لغايه دلوقتي a law insists that people have to inspect things real life and not through any other form of communication. Okay? يبقى السؤال اللي بعد كده بقى: how do you لا بيدرس wounds also in order to optimize the conditions of healing, and in order to while you're dressing you should minimize the chances of spread of infection. يبقى اللي فاضل بقى: how do you dress a wound?
بالأول بنمسح بصلاين.
ده ماجد اللي بيقول ولا مين؟ ماجد اللي بيقول؟
أنا يا دكتور.
طب يلا ماجد، سلاين ايه السلاين ده؟ كام في المية السلاين ده يا ماجد؟
0.9.
كام؟ العادي نورمال سلاين في درجة السلاين. اصلا السلاين هو كام في المية زي ما انت بتقول كده؟
0.9%.
0.9%. yes. يبقى you have to have saline. yes. What else? What else do you have to have?
Betadine.
You have to have betadine. yes. ايه البيتادين ده؟ ايه البيتادين ده؟
ايودين.
بوفيدون ايودين.
Povidone iodine. Absolutely, povidone iodine. Povidone iodine is what we call an iodophore. It's an iodophore. That is, it is povidone holds the iodine. It's different from tincture iodine. That is an alcoholic, يعني a combination of alcohol and iodine. But this is povidone iodine. كم في المية؟ povidone iodine ده كم في المية؟
15.
15. نقلل شويه، انزل شويه بالخمسه كده، انزل شويه.
10%.
10%. Iodine, povidone iodine is a standard solution. Remember that it shouldn't be diluted. You should not dilute povidone iodine. And one good evidence of it being diluted. عمرو انا معاكم لسه ولا ايه؟
حضرتك كده.
One good evidence of it being diluted is that when you use it in order to dress a wound, you sort of it does not form a continuous sheet. Yani when you take, obviously you're going to wear a pair of gloves, and you should check that everything is ready, because one typical scenario is that the nurse keeps going to and fro in order to get the equipment that the material that you need to dress. So this is very sad, because you need to have everything on the dressing table during your ward round, so that you do not lose time. You need to check that everything is there, and you need to wear a pair of gloves at the beginning. You wear a pair of gloves that is not necessarily sterile, and only a pair of gloves, and you have to lift the plaster off of the wound. Well, when lifting the plaster of the wound, there are two tricks. When you lift the plaster of the wound, there are two tricks. These are better shown real life, but we'll still show them. You shouldn't be getting hold of the adhesive side of the plaster. If you get hold of the adhesive side of the plaster, your pair of gloves tend to stick to the adhesive side. You shouldn't be touching the adhesive side of the tape, and you should be pushing the skin downwards so that it doesn't become tented. انتوا عارفين طبعا when you remove the plaster, it is a bit painful at times, because you pull on the hair. Even if the hair is not there are a few hair follicles with a few hairs that are just erupting out of the hair follicles. It is at times very painful, but it also may very well disrupt the very superficial layers of the skin. In elderly people and in people who have got unhealthy skin and people who have got are on steroids, you may very well disrupt the superficial layers of the skin. So that you have to, what do? You push the skin downwards with one hand, and you pull on the dressing with the other, so that the skin doesn't become tented. طبعا عارفين انتوا كلمة tent. A tent means that you make the skin look like a tent, as if you're pulling it with the dressing, which means that it is painful and harmful to the skin. So you should avoid this, and you should also not hold. You should only hold that part of the plaster that is not adhesive. The inner side of the plaster that is adhesive, you shouldn't be touching it, because otherwise your pair of gloves becomes a coat with the plaster, and it's a major problem. انواع البلاستر عمرو.
نعم يا دكتور.
المره الجايه النبي عاوزين نحط انواع البلاستر، لان نسينا نحط انواع البلاستر.
تمام.
اوكي. لكن you remove the thing, you dispose of all this business in a red bag, as I'm sure you all know, and then you're ready to inspect the wound. what signs are alarming in the wound? What are the signs that you may encounter in a wound that may not be very good?
The wound discharges pus or blood.
There may be a discharge, there may be blood, a drop of blood, the so-called red sign. Beware the red sign. The red sign is a herald bleed, which is very, very serious. ايه معنى الريد ساين؟ مين عاوز يقول لي يعني what is the red sign؟
لو في الابدومين دي herald of a burst abdomen.
طب ولو على الجروين مثلا، لو واحد عمل باي باس وعلى الجروين وات ويل الهيرلد؟ هيرلد طبعا يعني انذار، هيرلد يعني بتنذر. فالهيرلد يعني something that predicts that something bad is going to happen. أعوذ بالله. How about in the groin, for example, in the neck, if you expose the carotid, what does it mean if someone has got a femoral pedal bypass and anastomosis and they've got a bit of blood?
بلو اوت.
ايه؟
في صورة جابت الارتري
صح
خالص.
فدلوقتي كنا بنتكلم على الديفرنت تايبس اوف كلاستر. النبي عمرو يبقى شوف كده حط لنا انواع الكلاستر، لان انواع الكلاستر فيها كام تريك كده. والكلاستر that used in this hospital is the silk cluster that has got a problem, that causes allergy, and it causes a bit of injury to the superficie of the skin when you remove it. Obviously, it's again not transparent. It does not allow the breathing of the skin because it's not permeable and you can cut it easily. يعني الكرايتيريا بتاعت الكلاستر اللي احنا بنتكلم عليها is
دكتور انا اسف، ممكن حضرتك تفتح بس الفيديو؟ انا اسف. تمام كده.
فدي حكايه البلاستر. can you cut it or do you need a pair of scissors in order to cut it? Is it allergenic or is it non-allergenic? Does it allow the skin to breathe? Is it conformable? Does it take the shape of a wound or the shape of the area? من الحاجات برضو اللي احنا نسينا نقولها ان when you stick the plaster you have to make sure that you don't stick it while, for example, if you're sticking it over a joint with the joint flexed, you have to stick it to the joint maximally extended so that you allow for the movement. Otherwise, you can imagine that if you stick it on the tighter side, people start moving and it causes them loads of pain. So if you're crossing the knee, for example, and if you've applied the plaster while the knee is flexed, and then people get out of bed and they try to walk, then they extend the knee and they suffer a lot of pain. ده عمرو حط ديورابور اعتقد ديورابور زي او بيبر ميديكال تيب، زنك اوكسايد ميديكال تيب. دول الانواع المختلفه different types of medical tapes. Trans4 is an excellent one. Trans4 عمرو يبقى شوف لنا ونبي Trans4. I think it's very similar to Durapor. I'm not so sure. Trans4 والترانسبورت ده ميزته ان هو بيبقى when the plaster is transparent زي ما بيقولوا ساعات see through، بيبقى it's a very good advantage because then you can inspect the wound without taking it off or anything. Okay? You can also it also Trans4 it also allows the skin to breathe because the skin breathes and you do not want the water vapor to accumulate between the dressing and the wound. اوكي، يبقى انواع البلاستر اللي بنرجع لها في فابريك بلاسترز. يمكن عمرو هيورينا انواع البلاستر مره ثانيه دلوقتي، لكن عمرو let's get to another point اللي هو how will you continue on the dressing. هنرجع بقى للورقه بتاعتنا. لما نشوف الورقه بتاعتنا كده عمرو، فين الورقه بتاعتنا؟ نجيب الورقه بتاعتنا.
حاضر. دي ولا الثانيه؟
لا هي دي اهو بالظبط الحاجات اللي نسينا نقول. شويه حاجات موجوده كنا بنتكلم عليها. البيتادين 10%، 7.5 the scrub, the surgical scrub, hydrogen peroxide. We didn't mention anything about hydrogen peroxide. The hydrogen peroxide that comes in volumes. It comes in volumes. Hydrogen peroxide, the concentration in volume. It has to be 5 volumes. 5 volumes means that 1 milliliter will make 5 milliliters of gas. The concentration fat H2O2. The H2O2 is an excellent method to get debris out of a cavity. And obviously it's a bit anti-anaerobes and فيها طبعا oxygen. لكن يعني it's not very much that. It's sort of great gas of bigger volume and hence it gets the debris out. H2O2 طبعا you wash the wound with H2O2. It's a bit irritant. You have to dilute it. It's bleaching. Remember that H2O2 causes the bleach, and it has to be no more than 5 volumes. You have to check the bottle of H2O2, and if it's more than 5 volumes, you have to dilute it using saline. Betadine should not be diluted. It should not be diluted. And when you use betadine on anything, you have to, which direction do you dress a wound, a closed wound? مين هيقول لي الدايركشن اللي بنغير بيه بنمشي بأنهي اتجاه؟
يعني circumferentially ممكن ولا ازاي؟
Circumferentially from the inside to the outside, أو longitudinally in one direction. It can be longitudinal in one direction or circumferentially from the inside to the outside. But you shouldn't be exposing the wound itself to areas that are lying outside the wound. I mean the wound outside, but not from the outside to the wound. You can choose a vertical direction so that you go in one direction from above downwards or from below upwards, whatever you choose, but it is only once. You throw your piece of gauze and you use another piece of gauze. طبعا the gauze and the instruments and everything are packed separately. You cannot pack them in a drum like in the past. In the past, there used to be a big drum where everything is put in and you get them out using a forceps. طبعا this is catastrophic. Today, معلش. glycerine magnesia اللي هو الhygroscopic that causes dryness of moist wounds. Hygroscopic glycerine magnesia that is put as a moist dressings. Dressings are either dry or moist. طبعا with a closed wound, you don't put a moist dressing, you put a dry dressing. But with an open wound, you may put glycerine magnesia as a moist dressing. As a moist dressing, glycerine magnesia is hygroscopic. It sort of causes an autolysis and a debridement. طبعا Vaseline goes, paraffin goes. If you've got a raw area, again, you don't want the dressing to stick to the wound. You want it easy removed without injuring the granulation tissue. So you may use Vaseline gauze, paraffin gauze, petrolatum. Petrolatum is like Vaseline and paraffin. It's a derivative of petroleum. Vaseline gauze, paraffin gauze, petrolatum jelly, Sufratul. Tul is like a network. Sufratul it's the same thing. كل حاجات نفس الحاجات. At times they're impregnated with an antibiotic. Very commonly it is fusidic acid. Fusidic acid, you can impregnate these dressings using antibiotics like fusidic acid, which is a very weak antibiotic that is used basically to treat osteomyelitis in combination. It is anti-staph, but in this situation it's used topical. يبقى عندنا هم betadine 10%, 7%. Remember, it shouldn't be diluted. If you dress the wound using betadine, if it becomes a discontinuous sheet, يعني a patch of betadine and then nothing, and then a patch of betadine, then you know it's been sheeted and it's diluted. But if it forms a continuous sheet, then you know that it is not diluted and it's the correct thing. Betadine, remember that if you're using it for your scrub, this is different because it's a bit soapy. But with the one that's used for the wound, it is not in its 10%. دي الحاجات اللي المفروض تبقى موجودة. Revise the concentration any of the things that you use. At times you use antibiotic sprays, Bivatracine. They're not very useful. Remember that you can, if the wound is already 5 or 7 days old and it's closed and it's not contaminated, you can leave it open as long as the individual knows and they agree. They can very well, after 5 or 7 days, leave a wound open. As long as your seniors know, as long as he knows, the individual, or they know, and they agree. They need to know because you don't want to be told that you missed on something and they have to agree because if they're not happy to leave the wound open, which I wouldn't be, they have to have it dressed. Calico compliant. Some things you cannot change while other things you can comply with because there is a good range of movement. Okay, antibiotic spray. الappearance of the wound appearances. احنا كنا بنتكلم على الdangerous signs وكنا بنتكلم على كنتوا بتقولوا على اذا كان في blood والred sign وكنا بنقول اذا كان في discharge اذا كان pus اذا كان green كلكم عارفين green pseudomonas اذا كان في odor لكن at the same time it could very well be that there is gangrene of the edges, very dangerous sign in the abdomen in particular, اللي هم يسموها Melanese post-operative synergistic gangrene. And obviously there can be a leak of something very dangerous like bile, like fecal matter, like yellowish intestinal contents, like greenish intestinal contents. Very dangerous signs indicating a leak, and it's going through the wound. You can also feel what we call the healing ridge. There is a bit of induration around the wound that is called the healing ridge. Obviously, if you're going to touch the wound, you have to wear a pair of sterile gloves, not the gloves that we use to shake hands nowadays and to get hold of things. The ones that are sterile in sterile packaging, and you have to open them with the peeling method. الكلام اللي كنا نقوله, you inspect the wound. It may be closed, not infected, closed, infected, open. والوانها بتبقى اذا كانت dry necrotic, black, yellow, sloughy, clean, exuding, ولا dry low exudate بالوان الاشكال. في انواع من الدريسنج مخصوصه بتكلم على when to dress a wound, when to remove stitches and how and all these things and why. في انواع مخصوصه من الدريسنج. في if the wound is exuding a lot, في الالجينيت. الالجين جاي من السيويد. الالجينيت اللي هو it swells and it absorbs. It is highly absorbent. يعني if a wound is exuding a lot, ده في الاوبن wounds. ده مش not for the closed wounds. The closed wounds احنا خلصناهم. وهنرجع نراجع مع بعض الستبس بالظبط للشيء للغيار حالا دلوقتي. Obviously a foam again is absorbable. You can absorb a lot of exudate using foam. And I don't know whether you're aware of vacuum assisted wound closure. These devices that apply a foam to the wound and they sort of acquire gas seal and they are connected to suction. We discuss them next time. ففي alginate, في foam, وفي نوعين تانيين اللي هم they provide fluid assessment for dry wounds اللي هم hydrogel that can take the shape of the wound. Hydrocolloid, both are hydrogel. Hydrocolloid they're used to provide fluid and a bit of water to the wound. Vapor permeable اللي هو الأوبسايت. هنشوف الحاجات دي مع عمرو حالا دلوقتي. الأوبسايت which is self-adhesive, see-through, permeable sheet that you can stick to any wound or the area that you're going to operate upon. عمرو هتورينا اشكال الحاجات دي. عمرو انتوا لسه معايا ولا مش معايا؟
مع حضرتك يا دكتور.
طيب معلش انا بعتذر يا عمرو النهارده ان انا بيت كده ورك اب لان انا فعلا الدنيا صعبه معايا النهارده بس معلش.
لا ولا يهمك.
هنعمل حاجتين عشان نخلص. هنشوف دلوقتي الوش الثاني وهنشوف الحاجات اللي انت محضرها. بس قبل ما نعمل كده احنا اتفقنا على الانتي بايوتيك سبراي على اسيتيك اسيد. ساعات بنغير باسيتيك اسيد فور سودوموناس ان بارتيكولار, بوتاسيوم بيرمانجانيت, silver nitrate. انتوا عارفين silver nitrate is a well-known all heavy metals are antibacterial, and you can use red subacetate in order to diminish the edema, and eventually you can use honey. في medical honey, and more you can use maggots اللي هم larvae of special fly species that cause an autolysis. انتوا عارفين one cause why we dress wounds is to avoid flies sort of lying the eggs and the larvae اللي هو اسمها ايه when you find larvae this disgusting appearance اسمها ايه؟ اسمها ايه يا جماعه؟
مش عارف.
ما حدش عارف مايزز؟
لا ما كنتش عارفها بصراحه.
لا it's not very bad surgically but it's a very disgusting appearance where you find these larvae everywhere. They are not very bad surgically because they sort of autolyze and debride the area. طيب يلا هنقلب بقى الناحيه الثانيه يا عمرو.
اوكي.
عشان نخلص عند النقطه دي. احنا لازم هنخلص النهارده لان الدنيا صعبه عندي قوي. هنقلب بقى يا عمرو الناحيه الثانيه.
تمام.
اهو ده كان الله يمسيهم بالخير حسن المصري وعبد الله. دلوقتي عبد الله مدرس مساعد اشعه عندنا, وحسن في الارم فورسز بلاستيك سيرجن. هم اللي كانوا عملوا دي. فهم الستبس التقليديه بقى جدا والتراديشن دريسنجز والحاجات اللي محضرينها زي ما مين اللي كان بيقول الصبح النهارده نورمال سلاين وبدون ادين 10% هيدروجين بروكسايد glycerin magnesia, dettol alcohol, طبعا absorbent cotton gauze and dressings اللي هو الكوتن جوز اللي جواه الكوتن اهو. ensure your safety PPEs personal protection equipment دي كلها بقى دلوقتي طول الوقت PPEs. do not touch beds, do not touch ده الكلام ده بنقوله من زمان على فكره. do not touch bed sheets, do not touch the floor, do not touch anything at all unless you desperately need to do that. prepare your equipment and washing water and soap and sterilium. طبعا sterilium is very common use nowadays. wear clean regular gloves اهو في الاول. remove the old dressing. you may use نسينا نقول you may use saline over an open wound because it becomes adherent. صح؟ do not get in touch with the adherent with the adhesive part. push the skin downwards. inspect the wound for taco of discharge. taco برضه من الحاجات الظريفه اللي هي type amount color odor. whenever you encounter discharge you apply the TACO acronym. Type amount color odor. Whenever you encounter discharge, there is the TACO approach. The type amount color odor, the odor, the amount, the color, and the odor, and then the type. Take the gloves off with dressing together in the red bag. Check wound healing. Rewash your hands. We don't do that actually. Wear another clean gloves. Clean the wound with normal saline and dry it. Clean the wound with betadine and let it act. Leave it for 3 minutes. Started betadine is criticized for 2 things. At times you're able to sort of culture Pseudomonas from betadine, and at times it causes a bit of delayed wound healing. Whatever thing you use locally will cause a bit of delayed wound healing. Take the gloves off and rewash your hands. Wear a pair of sterile gloves. وبعدين بقى fix the dressing. Put بقى the basic dressing on the wound. Fix the dressing with plaster tape. Write the date and things and document. انتوا عارفين not documented, not done. كانوا بيقولوا لنا كده documentation is very important and we lack it a lot in our medical system overall. اوكي عمرو انتوا لسه معايا ولا ايه؟
مع حضرتك يا دكتور.
PPEs كلكم عارفين PPEs. كل الناس بيتكلموا على PPEs nowadays. التاكو amount type amount color order. You find the discharge and you describe it. What is its type? Maybe this is the last thing, but you start with the amount and you start with the color and then follow the color and the order. Well, obviously, you end up with the type. Remember that if you don't document, then you have not done anything, because some people will complain that they have been dressed. But if you document and you write, then there is a good reason why you shouldn't be believing that you haven't dressed them. Okay?
تمام.
عمرو اخر حاجه معلش هنقولها النهارده وهنقف الحته اللي هي الكالر دي اللي قلناها مره قبل كده، واللي هو اذا كان بينك ده بيبيثيلايز، واذا كان يلو ده جرانيوليتنج. يلو ممكن يبقى سلافينج، بلاك ده ميكروتيك وونز، سانز اوف انفكشن، وكل واحده بنسجست نغير عليها بايه. معلش يا عمرو انا هقف عند كده النهارده.
تمام.